am now going to introduce our guest speaker. I'm going to introduce Dr. David Morton. One of many guest speakers. He will give today's commencement address. Dr. Morton is the Department Chair for Preparatory Learning at Brigham Young University School of Medicine. Dr. David Morton served for 26 years as a professor of neurobiology at the Spencer Fox Eccles School of Medicine at the University of Utah. And during his tenure, he served as Vice Chair of Medical and Dental Education, provided leadership in curriculum development, directed multiple courses, taught anatomy, physiology, neuroanatomy to medical, dental, physician assistant, physical therapy, and occupational therapy students. In December, Dr. Morton accepted a position at Brigham Young University's newly established School of Medicine, where he is professor and chair of the Department of Preparatory Learning. Dr. Morton has received numerous teaching awards, including the American Association for Anatomy's Henry Gray Distinguished Educator Award, the University of Utah's Distinguished Teaching Award, and the School of Medicine's Jarko Distinguished Teaching Award, I think just a couple of days ago. His scholarly interests focus on the development and study of active learning strategies and the educational use of cadaver donors. He is the author of several widely used textbooks, including The Big Picture, Gross Anatomy, and The Big Picture, Histology, and Gray's Dissection Guide for Human Anatomy. Dr. Morton is an internationally recognized educator and speaker, fellow of the American Association for Anatomy, and a visiting professor at numerous international medical schools. His educational YouTube channel, The Noted Anatomist, features over 300 anatomy video tutorials reaching students worldwide and has garnered more than 40 million views and 750,000 subscribers. Please join me in welcoming Dr. Morton.
Thank you, thank you. With so many graduating today, you game for one more test, just for old time's sake? What I'm gonna do is I'm gonna tap a song with my fingers, and I want everyone, graduates and everyone in the room, I want you in your mind to figure out if you can guess what song it is. You game? Here we go. How many guessed Rockabye Baby? All right, well, I just asked you to do something based on an experiment by Elizabeth Newton at Stanford. What she did was she took 80 students and she divided them into two groups, and she called them tappers and listeners. The tappers were given a list of 25 well-known songs, things like Happy Birthday, Twinkle Twinkle, Rockabye Baby, Edelweiss, Star Spangled Banner, etc., from which they were asked to choose 3 songs, and they were told that they would be tapping the rhythm of those songs for their partner. Now, the listeners, they were going to be guessing what the tune was that their partner was tapping, and they were told to then write down their guess for what the song was. Now, the tappers were given one more piece of information or instruction before the experiment began. They were to estimate what's the likelihood that the listener was going to guess the song that they were tapping, and they were told to write down their guess or their percentage of what they thought they would do. Now, the tappers and listeners were brought together, their backs facing each other, and told begin tapping and listening. Here's the results. The tappers were fairly confident in their percussion skills because they predicted that the listeners would accurately guess 50% of their songs. Guess how often the listeners guessed the tune correctly? 2.5% of the time. The tappers overestimated the ability of their partners to identify the tune by 47.5%. Now that I've reproduced Dr. Newton's results, all without your consent, and I hope IRB doesn't come after me for that. Now, what can we learn from this experiment? The tappers, they enjoy a rich experience of knowledge. When the tappers begin to tap, they inevitably hear the full melody, the lyrics, the tunes, rock-a-bye baby on the treetop, and so forth. That internal soundtrack is so vivid that it's almost impossible for them not to imagine that the listener can't hear everything that they're hearing. Oh, but it's hard to be a listener. All the listener hears most of the time is disconnected taps, like some bizarre Morse code. The tappers and listeners experiment demonstrates a bias, a cognitive bias, now known as the curse of knowledge. Once we know something, it becomes difficult, if not impossible, to remember what it's like not to know it. In a sense, we are now cursed with the inability to remember what it's like not to know the body of knowledge that y'all have just spent a number of years learning. Another term this is called is expert blindness. This tapper listener experiment is reenacted countless times every day in every setting and culture. For example, the physician sits down with a patient, tells them he has hypertension, to take this medication in this dosage this many times a day, and it has this side effects. The patient hears hypertension and wonders, what is that? A professor sits down with students and then says, I'm going to present the renin-angiotensin-aldosterone system pathway and the mechanism of action of ACEs and ARBs, and a student sees a list of confusing images and pictures and arrows, tap, 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 tappity tap. My dad liked to quote George Bernard Shaw, who famously said, the single biggest problem in communication is the illusion that it has taken place. There's nothing wrong. I want to make this clear. There's nothing wrong with a doctor or professor was trying to communicate. On the contrary, it's extremely important. What I'm saying is that their expertise comes with blind spots. And this important body of knowledge that they're trying to communicate may be getting lost in a series of Morse code taps. The result is the subject matter expert often fails to communicate what they know clearly because they fail to put themselves back in the shoes of the learner. This belies the basic concept of empathy. Communication is not what we say. Communication is what the other person understands. So, personally, my students don't experience the quality of my knowledge. They experience the quality and clarity of my explanation. And as our knowledge grows, so does the responsibility to simplify and to communicate it clearly. One of the most important skills each of us must develop is learning how to hear our own tapping through someone else's ears based on their level of understanding. Let me highlight this with a story. A few years ago, researchers went to the Minnesota State Fair and surveyed 200 adults with no medical training. They asked them to listen to common phrases that doctors use and to tell them what they thought those words mean. For example, one scenario went like this. Imagine you've just had surgery for cancer. Your doctor comes in and says, your nodes are positive. What do you think the doctor's telling you? About a third of the people got this wrong. They assumed positive meant good news. Why? Because the rest of the world thinks that. But in medicine, your nodes are positive means cancer has spread to lymph nodes. Positive is bad in this case, not good. So these individuals didn't get it wrong because they were not smart. They got it wrong because we were not clear. Doctors, scientists often use words that is obvious to them, but not to their listeners. This study's conclusion, published in JAMA in 2022, was simple but sobering. Doctors believe they're communicating clearly, They hear the music perfectly in their heads. But patients only hear. Do you know what the problem with communication is? We, the experts, always assumed it happened. And just to be sure that you have not missed this point, each of you graduating today is now, ready for the air quotes, the expert. Now, you might be saying, nuh-uh, no way. I just finished my bachelor's. No way. I've just finished my master's. I'm going to do my PhD. I'm headed into my postdoc. I'm a brand new guy in a lab. I'm not even going to know what's going on in my residency. Okay, fair point, true. Within your specialty, within internally facing, like that. But externally facing, guess what? All we are going to see is your white coat, your name badge, and the titles behind your email signature. And when we see that, we say, the expert. This is an incredible responsibility, and each of you must learn to take that body of knowledge you have spent years learning. Some of you have been in school longer than my mortgage, and communicate it with others, one patient, one family, one student, one lab, one class at a time. So how do we overcome this expert blindness, this curse of knowledge? How do we, the experts, share the music in our heads? Couple of points. Number one, we need to create experiences that, like a magnet, draw those we communicate with closer to us so they want to hear the music in our heads. Freddie Mercury from Queen, he was the master at this. He improvised the iconic "Ayo" in his music, that he would have this back and forth with the audience. It became one of his signature moments. He composed "We Will Rock You" specifically to encourage clapping and stomping, turning it into a crowd anthem. He said, I want the audience all the way to the back row involved. Now, some of you may be saying, yeah, but Dave, students and patients are not in a rock concert. True, fair point. Now, maybe they are not, but would our students and patients listen to us more if we purposely involve them in our communication, if we purposely involve them in this learning experiment? Secondly, we need to bridge our body of knowledge with common things that those we communicate with understand so they can hear the music. Bridge our body of knowledge with something they already know. I remember reading about this debate between a lawyer and this influencer who had gained a lot of followers. They debated back and forth, and then the lawyer asked a question of his opponent. You know, one of those where the audience pauses? It's like Puss in Boots. Ooh, you had like all of a sudden everyone was stopped, a mic drop moment. The response was incredible, immediately understood to everyone, so a child could understand and a lawyer could understand. And that answer profoundly influenced ethics, laws, and religion. The lawyer's question was this: who's my neighbor? The influencer paused and responded through story. A certain man fell among thieves, which stripped him and wounded him, leaving him half dead. He described two people that ignored him and walked by on the other side of the road, someone from his neighborhood and his religious leader, but an enemy of his neighborhood. A certain Samaritan had compassion on him, bound up his wounds, and took care of him. Then this influencer, Jesus, turned back to the lawyer and replied, which now of these three thinkest thou was neighbor unto him that fell among thieves? This answer in story form is now considered one of the most recognizable stories in the world. The story of the Good Samaritan. When asked a question, Jesus responded with a story using things that everyone listening would know: people, places, circumstances. This parable has shaped society profoundly, expanding moral responsibility beyond social, religious, and cultural boundaries. That term, Good Samaritan, has become synonymous worldwide with selfless service to strangers. It inspired Good Samaritan laws for protecting bystanders, aiding someone who's in need. Good Samaritan signaling for cooperating healthy cells and enzymes deficient neighboring cells. There's a reason Jesus used analogies and parables to teach. Because he was trying to communicate a message, not look smart. His answer did not use AI, did not use the internet or a complicated algorithm. It came from an expert who knew his body of knowledge and his audience. And he communicated in a way that people could understand, remember, and act upon it. With so much information in the world, what will you, our rising generation of experts, do to help communicate your knowledge and your wisdom so it is understandable and memorable and spurs others to action? And I'm just a romantic at heart enough to believe that knowledge that each of you leaves with has the ability to change one lab, one experiment, one student, one patient, and the world. What will determine if you will do that? If you can take the music in your own head and help others hear it. Thank you. So, thank you, everyone, for, yes, thank you for that, by the way, because I'm really nervous. I started a tradition that really came in with the legacy curriculum for the medical students. This graduating class of medical students is the last class of the legacy curriculum. And so thank you for humoring me and letting me share a song that I've done at the end of the very first course in the legacy curriculum, but I'd like to do now at the very end of our graduating students and our all the esteemed other graduates. Thanks. Another turning point, a fork stuck in the road. Time grabs you by the wrist, directs you where to go. So make the best of these days and don't ask why. It's not a question but an answer learned in time. Something unpredictable, but in the end it's right. We hope you had the time of your life. The olfactory nerve tells you that the anatomy lab, it smells. Studying nights, holidays, and weekends is tantamount to hell. You're leaving right now before the new school grand opening. Look on the bright side, well, there isn't one, that sucks. Keep whining, there's something unpredictable, but in the end it's right. We hope you remember medicine the rest of your life. Dissertation completed, poster printed, grant denied. Then finally accepted. What a sweet surprise. I wonder if my journal submission will get through. Fingers crossed, if it wasn't for reviewer number 2, it's something unpredictable, but in the end it's right. We hope you remember science the rest of your life. Pupillary and corneal reflexes are situated in your eye. The AAMC graduation questionnaire makes you want to cry. The splenic artery is convoluted like a coiled spring. I'd be remiss if I didn't do one last shing. It's something unpredictable, but in the end it's right. We hope you remember medicine the rest of your life. For the past 4 years, you had no social life because of histology, radiology, cardio, weekend call, pulmonology, psychiatry, pharm, neuro, euro, nephrology, clinical service, EKGs, H&Rs, and rounding bedside. Instead of paperback novels, you now read PowerPoint slides. Nucleic acids, RNA, CRISPR, and ribosomes. Now that I'm at BYU, I can't teach C7 dermatome. It's something unpredictable, but in the end it's right. We hope you remember science the rest of your life. Sorry, it's a bit of an inside joke. We know that moving is a royal pain in the thigh. Labs, friends, and family, hard to say goodbye. We know that all your hard work will come to fruition. We think that each of you is gonna make a mighty fine physician. It's something unpredictable, but in the end it's right. We hope you remember science the rest of your life. Your patients hope you remember medicine the rest of your life. We hope you had the time of your life. Thank you. Thank you. Thanks, everyone. Thank you.
I'm speechless.
It's hard to follow.
Yeah. Thank you, Dr. Morton, for the many, many years you have given us.